This is Dr. Robert Bates at Leominster Chiropractic Spine and Injury Center. Today we're going to discuss several of the new literature articles concerning body fat and more specifically white adipose tissue. We have seen for quite a few years that there is a much greater increase in people for heart disease, high blood pressure, stroke, other types of cardiovascular disease, and diabetes if you are overweight. But today we're going to discuss some of the specific literature that explains why this is so, and this is quite alarming if you have extra body weight, and hopefully you will be able to get on a good program and lose this excessive white adipose tissue. The first study we will discuss was actually in Dr. Perlmutter's The Grain Brain, published in 2013. He cites an article where there was a correlation between several problems in the brain in relation to the waist to hip ratio. The larger the waist to hip ratio, in other words, the more size of the belly, there was a reduction in the size of the hippocampus in the brain, which correlates very well with memory decline. There was also another research article quoted in The Grain Brain, which actually states that the larger the waist to hip ratio, the greater the propensity for small strokes in the brain and vascular damage and brain tissue dying, which again correlates well with a memory decline and other cognitive function decline. Another article in The Grain Brain by Dr. Perlmutter showed some very interesting facts. Following a group of individuals from 70 to 75 years of age, they looked at three groups, one of normal weight, one which was considered overweight with a BMI above 25, and an obese category where the BMI was over 30% or over 30. And what they found was the brain size was reduced by 4% in the overweight individuals and 8% in the obese individuals. And most of the size loss was frontal lobe and temporal lobe, which is responsible for your cognitive thought and your memory. So this was very alarming and correlates with the symptoms that we see in these overweight and obese individuals. Another interesting thing seen in the same study was that the average brain looked 16 years older than the underweight or the actual normal weight 75-year-olds compared to the obese individuals. And the brain looked 8 years older in the overweight individuals. So this is enough information to get you pretty concerned about your brain function if you are overweight, because there's really no way you can escape the fact that you are pro-inflammatory and causing these devastating changes throughout your body. Another study by Dr. Kuntz in the Journal of the American Academy of Orthopedic Surgeons showed that there is a secondary factor in the adipose tissue or in all of the fat cells. We used to think that these were non-active storage depots of adipose tissue or fat, but we are finding out in the research that over 100 cytokines are released from fat, and it actually becomes the largest endocrine functioning organ in the body, all of your fat cells. The more fat cells you have, the more active they become, releasing these pro-inflammatory and immuno-regulatory cytokines, which have devastating effects through your entire body, including brain and all of your arteries and organs and pretty much all of the systems in your body. So the greater the waist to hip ratio, again, the greater the number of active cytokines released into the bloodstream, and essentially large people are walking around in a pro-inflammatory state, destroying their entire body because of this endocrine production of these cytokines that are pro-inflammatory. Another very interesting article by Dr. Siemens has shown over the last few months that there is a tremendous change in the function of the adipocytes or fat cells the larger the number and size of these fat cells become. It involves a change in the immune system and, again, an increased inflammation throughout the body. I'm going to read from this article the last paragraph since I don't want to get it incorrect. The emerging interpretation is that adiposopathy, which is actually the term now used for having too many fat cells, and the related metabolic syndrome leads to pain chronicity because the associated non-resolving systemic inflammation is a pathophysiologic state that promotes nociception or pain in injured dysfunctional musculoskeletal tissues and prevents healing and pain resolution. So we therefore see that people with excess adipose have obesity and additional health and disease markers. They have elevation in fasting blood glucose. They have elevation in fasting triglycerides. They have elevation in blood pressure, reductions in high-density lipoprotein cholesterol, or the good cholesterol that takes cholesterol out of the bloodstream or fat. These 5 markers reflect the presence of adiposopathy and comprise risk factors for the metabolic syndrome. So if you look at the newest literature concerning the amount of fat in your body, it is really causing a tremendous reduction in lifespan and an increase in so-called lifestyle illnesses. So hopefully this will give you a little bit better information, and you will change your behavior because your belief system will be slightly changed. And you know now that you must get serious about cutting excess body fat. Good luck and God bless.